Yay! We're live Q&A with me. So exciting. Welcome, welcome, welcome. I'm so glad you guys are here. So we're going to start with some questions. First preface this is that although I'm a medical doctor, I can't give medical advice, right? This is for educational purposes only. We have to say that every time. But we're going to start with questions that were answered or questions that were submitted, okay, through the Q&A. Then you can also drop some in the comments if you have them. But one of the first questions that was asked is, how do I know if this is perimenopause making my symptoms worse? Is it my ADHD making my symptoms worse? Or is it both? Okay. And this question is actually really important because the answer is not as straightforward and simple as saying, no, I think actually this is your ADHD or this is your perimenopause. The answer really lies in between what your personal symptoms are and kind of what's going on in your body and where you are in the course of midlife, right? So not everybody, just because you're 40, not everybody that has brain fog means that they're estrogen deficient. Okay. So we have to look at everything. And again, you're going to hear this over the course of time. Anytime you come to one of my lives or anything you see, anything I write, this really is precision guided medicine, ladies. What is happening and right for you isn't going to be what's right for your friend, right? But what we see most of the time, if you are diagnosed with neurodivergence, when midlife starts to hit, so what does that mean, right? And what it means is when estrogen starts to become deficient, when progesterone starts to become deficient, as well as testosterone. And remember this, progesterone can start declining in our 30s. Testosterone can start declining actually in our late 20s. So, what happens when we get to our 40s, 50s, right, as estrogen starts to decline, we feel the combination of those things, right? So, we already could have a lower progesterone. And just keynote, a lot of women who are neurodivergent actually do suffer from lower progesterone, right? Especially if you're someone that has PMDD, that can be the one of the issues they're adding to. So then we get to this transition point in our life, and we start to lose the estrogen piece, and then everything kind of feels like it's all over the place. So the answer really to the question, is this my ADHD or is it perimenopause? If you're coming into perimenopause already diagnosed with ADHD, or if you're neurodivergent and you're in your, late 30s, 40s, and you're starting to feel like things are falling apart, it very well could be perimenopause. Okay. It could be estrogen deficiency or estrogen becoming chaotic, right? That's the piece of perimenopause that makes it so crazy is estrogen's not just declining, but it's declining and peaking and declining and going up and down and sideways. And for our neurodivergent brain, that is what we like the absolute least, right? Is those what we call those deltas, those swings. That does not work well for our brain. So this is where we can see some of the symptoms. What I would say is start with tracking your cycle. So are they still regular? Are things happening still right on track with the cycle? When did the symptoms kind of start coming up or symptoms get worse, right? Because a lot of times, we've never felt like our neurodivergence has been completely what we would say controlled or optimized, right? What is that looking like? What has changed recently in your life, right? Are you eating differently? Did you lose weight? Are you taking different supplements? Have you been started on a new medication, right? Sometimes it's those types of things that are also happening. So we want to look at that piece and then get that full evaluation so we can say, is there a hormonal component to this? Is there a micro macronutrient component to this? What's actually happening, and going on? And then there's a lot of talk, and there's about five different questions asked about burnout. Is this burnout? Okay. And a lot of people said, is this burnout? Is this perimenopause? Or is this ADHD? Like, is my ADHD? I'm just exhausted from it. Guess what? Same thing. All of those feelings can feel very identical. One of the most common things is fatigue. And here I want to put this in, give a little context to how perimenopause can actually affect our neurodivergent symptoms. So remember that estrogen is responsible for 400, that's insane, 400 reactions in the female body, okay? And as estrogen declines and starts getting chaotic, and those estrogen receptors don't have as much estrogen attached to them, guess what? That affects our prefrontal cortex, right? It also affects our body. This is why women have hot flashes, night sweats, joint pain, there's my neurodivergent brain, plantar fasciitis, frozen shoulder, weird sensations in your tongue, itchy ears, right? 400 reactions in the female body estrogen plays. But one of the biggest pieces for us and from a neurodivergent standpoint is the brain. Okay. Estrogen receptors in the brain, we have the most estrogen receptors in the brain. And so, guess what? That prefrontal cortex, where we do all of our executive functioning, where we already have some trouble with, as estrogen goes down, right? Then that part of the brain isn't getting as fed as much as it was before. So, if we were already struggling with our neurodivergence, add on some estrogen changes from perimenopause. And we already talked about you probably have a lower testosterone and progesterone, right? And remember, testosterone also works on the prefrontal cortex. Okay. Testosterone is very powerful for the neurodivergent brain. So now we've kind of tipped everything over to the edge. And we can be burned out from a neurodivergent standpoint before perimenopause, right? And you probably have been in times of your life. But now add in the fact that we are taking a hormone that is responsible in part a lot for that prefrontal cortex. And now we're decreasing the amount of it. This is why we can't mask, right? This is why, even though we've done that for our entire life, that mask starts to fall off. Because we actually don't have the cellular capacity, ladies. That's literally what this is, okay? Estrogen deficiency and chaos, we lack that cellular capacity to keep that mass pulled up. Not to mention that on top of that, we're having issues with sleep, right? Like that's a huge piece of this. And what? Chronic stress, right? Sympathetic overdrive is so huge. And it's huge for us because what we need to maintain our neurodivergent brain in somewhat of what we call living in the neurotypical world takes a lot of effort and a lot of energy. And we stay very sympathetic all the time. Okay. Adding on to that is a big deal. I think it's a big, huge thing. One of the next questions is I went to my doctor and I asked for my labs. I asked for my ferritin. My ferritin is 20. However, my doctor said that's normal. And I've read your stuff and I know it's not normal. What do I do? Okay. So great question. Brings up a really good topic, which is what labs are actually normal and what is ideal and optimal. Okay. And just because those labs fit between the green lines does not mean that they are optimal. Do you know that how they get that lab number between the green lines is really taking 100 people from the age of 3 to 93, and that's how they get an average? Yeah. Right. Like, of course, that's not going to be optimal. So from a ferritin perspective, 20 is not optimal. To me, when I review my patients and it says their ferritin is 20, I'm like, oh my gosh, you must feel fatigued and tired. And is your hair falling out? Right? 20 is not good. Remember, ferritin is our iron stores, right? It's so how we store the iron. And that matters because iron is used in so many reactions. Do you actually know in order to make serotonin and dopamine both, you have to have iron and you have to have B6, other things too, but those are in the direct pathway. Okay, so you can only imagine here that if our iron stores are low, that we're probably not making as much serotonin and dopamine or as effectively as we could. Okay, that's where we see all this problem. Restless legs at night, exercise intolerance, right? And some of us our hemoglobin and hematocrit are normal. And the ferritin is low, so the iron storage is low. So sometimes if we're not checking ferritin and they just look at your hemoglobin and hematocrit from anemia perspective, they just say, oh, you're not anemic, everything looks good. When in real truth, your iron stores are low, right? And we need to bring those up. And then there's another, the neurodivergence piece brings another level into this because very interestingly enough, I see a majority, and we have to do the studies on this and we're trying, but I see a majority of neurodivergent women with suboptimal ferritin. Okay. And I think that that's multifactorial. I think gut problems bring a whole level into this. Gut dysbiosis, which will be another live we do. This month's webinar for all of our amazing paid members is on sleep. But I think next month we're going to talk about gut and dysbiosis because it's huge. And I see it all the time, right, on the neurodivergent piece. Um, so I think there's an absorption problem. I think we have food aversions too, a lot of times. And so, like, not only absorbing nutrients, but how we're getting those nutrients into the body. Are we getting enough of those? And then I think 100% period abnormalities, heavy bleeding, all of these issues that come are a big problem from the ferritin. And actually, there was another question about ferritin, which is why is my ferritin low when I eat red meat? Which I thought was a great question because it's multifactorial. It's not even just about what you put in the body. You actually could be fueling the body correctly. But if you're not absorbing it, right, and you're not able to absorb and then utilize those nutrients, say because your gut is not functioning well or you have leaky gut, right, increased gut intestinal permeability, that can also be the problem, right? So you can see the issue could be from multiple realms. One of the other biggest things that we see that is inflammation. Inflammation is a trigger of malabsorption. And one of the things that a lot of us from a neurodivergent standpoint is inflamed, and especially if we're in midlife. Here's one of the 400 things that estrogen does, right? When it goes down, inflammation goes up. Why? Because cortisol can go up, right? So remember that. Remember that FSH is what knocks on that door of the ovary, FSH, ovary. Hey, give me the estrogen. And then the ovary's like, sorry, pal, that's all I got. So the FSH climbs and it goes and knocks on the door of the adrenal gland. Hey, pal, you got any, estrogen? And it says, no, but I got this cortisol. You want that? Sure. Right. And then cortisol goes up. Okay. Then inflammation goes up. Then insulin resistance goes up. Then we're absorbing even less. Okay. So you can see how this ferritin and the absorption is multifactorial. And we have to really look at the whole picture. Also, if a woman is already menopausal, we still can see low ferritins. And why is that, right? It's not from heavy bleeding during menses, right? So that goes back into absorption. Do you have the blocks you need to utilize the iron? Are you taking in enough protein, right? Do we have enough amino acids? Are we taking magnesium? Are we doing the things we need for the building blocks of all of this stuff? So you can see again how this is not something that gets solved in 7 minutes, right? This is really where precision guided care comes in. And it's the care that you all need to demand, honestly. Okay. The next question is my labs are normal. And I'm going to put that in quotes, normal, because what does that mean? Why do I feel so terrible? Yeah, this is a good one. Here's the thing, and I can say this with so much confidence. I see this in my office every single day, day in and day out. Women will come in and say, Dr. Sarah, I don't know what to do. These are the labs I had done. They tell me that my labs are normal. Everything is fine, but I still feel terrible. Guess what? 2 things. Number 1, they don't know how to read the labs. And number 2, they're not even looking in the places that we need. And I'm going to give you a few examples. Ferritin is one of them, right? A full iron panel includes a ferritin. Okay. So go look at your labs and make sure you have a ferritin. Number 2, a full thyroid panel. Thyroid panel, TPO antibodies, TSH, free T4, free T3. And if you have symptoms, reverse T3. Okay. We have to look at that all. Okay. Is your thyroid elevated? Right? TPO antibodies. Do you have inflammation? Okay. Here's the thing. The traditional system doesn't look at that, right? They look at T4 and TSH if we're lucky, right? And guess what the matter of the fact is? Your TPO antibodies can be elevated, right? And your thyroid numbers can still look normal, but your body is attacking your thyroid, right? Why wouldn't we be doing something about that? why wouldn't we want to reduce inflammation? And I have to argue with the traditional medical teaching that if our body is attacking something, of course we can feel symptomatic from that. Hello, right? And our body is talking to us. It's yelling, it's saying, hey, something is attacking me, help me. Just because the TSH and T4 look normal doesn't mean that we're still not symptomatic from that and we still shouldn't do something about it. So, having normal labs really means nothing because I don't know what those labs are. And how do we have to make sure you're getting all of those labs, okay, to tell you if they look normal or not. Same thing from a hormone perspective. Testosterone in a woman that comes back at 25 is technically normal. However, do you want a testosterone of 25? I don't. We should be about 80, 90 to 100. Some of us 110. So do you think 25 seems normal? When I tell you, especially from the neurodivergent perspective, that we need testosterone in our prefrontal cortex, do you think if you have testosterone floating around of 25, that that's going to make you feel better? No, folks, no, right? So normal doesn't mean a dang thing. It's really optimal. Okay. It's really optimal. Here's another thing. If they're, and most of them aren't looking, your high sensitivity CRP, your homocysteine, if your inflammatory markers are off the chains, you're going to feel bad. Your body is working overtime, right? We have got to jump in and help it. So you feel bad. We got to go off symptoms and we got to look at the right labs. Okay. The right labs. Here's a good example. What they say is a normal B12 is not. 400 for B12 is not normal. Your B12 should be 900, right? I like 900 to 1,000 is what your B12 should be, especially from a neurodivergent perspective, from anybody perspective. But I also don't like B12s to be too high because they're precursors in our brain and they can actually make us feel a little bit on, okay? Like stimulated, okay? If we're not careful. Same thing we talked about the TSH, vitamin D too, right? We need vitamin D for our brain and our vascular health and our bones. But they say 20, 25 is normal for vitamin D. No, it isn't. Okay? We're looking at vitamin D is kind of the same as your ferritin, 70, 80, when we need our vitamin Ds to be a lot higher. And I'm just looking out my window in my office because it just started torrentially downpouring. So I can hear it. I don't know if you can, but I can. So yeah, B12, vitamin D. Guys, ladies, listen, also vitamin D, we saw this actually in COVID, but vitamin D is actually also responsible for our immune response, right? Vitamin D is so much more than a hormone. It's so much more than a vitamin. It acts more like a hormone, but it also works on our immune system. Okay. And that's why we actually saw patients in COVID, um, patients in COVID who had lower vitamin Ds did worse, right? And I think that's because they didn't have that immune reserve. Their immune system was already kind of flat, right? And then we add on another, kicker on top of it, COVID, and then we had, issues. So vitamin D is very, very important. Then another question was, can low iron make my ADHD symptoms worse? Now, here's what I told you before. Iron is involved in dopamine synthesis, right? You need iron in B6, right? Remember? And right in that direct, that's neurochemistry, folks. Neurochemistry, okay? It's right in all the books, okay? So, yes, your having lower ferritin can make your ADHD symptoms worse. Now, does that mean low ferritin caused ADHD? No. Does that mean everyone that is neurodivergent has a low ferritin? No. None of those, no, right? However, if you do have a lower ferritin and you are neurodivergent, it can be affecting your symptoms. Again, we have to look at the individual. And I'm going to be really honest, 100% of the time, this is multifactorial, right? It's not just someone has a low iron. It's someone has a low iron. Their thyroid is a little off. They have macronutrient deficiencies. Their gut isn't working appropriately, right? And we have to work on all of those things. That is what longevity is. Okay. If there was one pill, one treatment, one thing that we could all do and make all of this better, don't you think we'd be doing it? Because I would. It's not that simple, right? We really do have to work on all of these things together. Okay, my hormones are shifting, my labs are low, and I'm burned out. Where do I start, Dr. Sarah? This all feels so overwhelming. There's lots of information on the internet, but I just don't know where to start. This is such a good question. Okay. And here's why. Number one, she's completely and utterly right. There is so much information on the internet, right? There's so much information, and it is like, where do we start? And I want to say this, and I want to say this really clearly, that a lot of information that is out on the internet, a lot of these wellness trends, a lot of this stuff doesn't do well for our neurodivergent brains. Now, that doesn't mean that the principle isn't right. And I'm going to give you some examples. So, hormones, for example, we're shooting now from the zeitgeist how hormones and estrogen and testosterone and all of this is such amazing and a miracle. And it can be, right? It's a very precision guided tool, and it's very important for women's health. However, it is also precision guided. Okay. And your neurodivergence plays a huge role in how you're going to react to hormones, just like how you've reacted to all the things that you've taken in your life, right? Majority of us from a neurodivergent standpoint are more sensitive. So if you think that you're going to just take the average dose and that's going to be it and be wonderful, and estrogen is this beautiful thing and you're going to take it and all is right in the world, that's usually not the case. My neurodivergent ladies, I start very low and slow. We have to be very purposeful with progesterone. Testosterone's kind of a little bit easier. We just kind of ride that out. There's not too many ups and downs with that when done correctly. But where to start is by looking for the right advice for us. Okay. So I would say that. I would say number one is we got to get the information, right? We have to look at the labs. This person's particularly says their hormones are shifting and their labs are low, so they know that. But we also have to make sure that we're working with doctors and providers who understand the neurodivergent component of this. Okay. Well, especially when we're looking from a hormonal perspective. Also, I don't just treat my patients from a hormonal perspective. I treat their whole body. Okay. Are you eating enough protein? Are you getting enough vitamins? Are you getting enough sunlight? How is sleep? Okay. And majority of the time, all of these things are off, right? Is your thyroid a component? Do you have low ferritin? Do we have gut dysbiosis? And then we pick those things apart. Okay. And I would say, where do you start is that you start with finding a provider or physician that understands longevity, health, hormones, and neurodivergence. And I don't say that lightly because I know that that's a really hard ask and hard to find, but that's where we start. And we start with looking in these groups, right? Talking to women that are neurodivergent, right? And looking at people that are talking our language and things that work for our body. Because guess what? The zeitgeist isn't wrong. Those wellness trends aren't wrong. We just need to manipulate it a little bit, right? So, for example, all of this like food prepping, meal prepping, just meal prep. It's so easy. It drives me absolutely insane because that's part of my neurodivergence. I'm not touching nasty chicken, not doing it, right? I don't, on a Sunday morning, I may not feel like it. What if I only have 6 safe foods, right? So having meals that are ready and active to eat is a big piece of our neurodivergence. But meal prepping may not be something that we're going to do, right? But we still need to have meals that are ready. So it may be something like buying Factor or working with a local company to make these things so they're in our way and we don't forget to eat. It may not be the actual act of us actually meal prepping. Same thing with movement, right? So yes, we have to move our body. That is so important. But I'm not going to the gym where people are slamming barbells and this and the lights are burning my eyes and like it's so overstimulating, right? I'm working out at 5 a.m. in my home gym. That's my solution, right? Maybe for you, it's wearing headphones or going later or earlier when there's not a lot of people or doing something alternative. We still have to move. The basic premise is there, but we have to adapt how we do those things. Okay. So that was a long-winded way to say we have to one of the best ways to start is in these communities, right? What are the things neurodivergent women are doing that potentially could work for me based on my symptomatology? I don't know if you guys can hear that rain, but it's insane. Okay. The other part I would say, if you're like, I'm so overwhelmed, where do I start? Is what is draining you the most right now? Like, what is the thing? Like, is it your sleep, right? If I could, I always start my consults with my patients to say, if I were a fairy godmother, which I'm not, bippity boppity boo, nothing works. But if I were, what would be the top 3 things that I could optimize for you or take away right now? That's a question you can ask yourself because that gives you a better idea of what's affecting you the most and then gives us a better idea of what we can work on first. And I take that information and I look at all of the data and the labs and everything and I say, okay, what is most connected to the symptoms that are really bothering her right now and where can we get the biggest impact? A lot of times I'm doing a lot of bridging things, right? Because if you have micro, macro, and nutrient deficiency, if you're not sleeping, if your hormones are off, those are things that are going to take us a while to fix. So I try to bridge the gap. I use a lot of peptides and things like that to bridge that gap, to give you a little bit of cellular energy back, to take some of that symptomatology away while we're building that foundation back up and around. Okay, let's see. I have felt depleted for years. Do you think I can actually recover? It's a good question. And it's a powerful and meaningful one because so many of us feel this way, right? Like, I don't know about you guys out there today, but some days I look around and I'm like, I don't know if I can actually just go on one more day, right? Like, I don't think I can do this rat race anymore. I feel so depleted and so overwhelmed. And the answer to this question is yes, you absolutely can feel better. Is healing linear? Absolutely not. Is there going to be ebbs and flows? 100%. Okay. But you can get better. You can feel better than you do right now. I promise you that. Okay. 10%, 15%, right? And then that adds on. I'm not saying this is simple. And I'm not saying it's linear because it isn't. I'm not saying it's going to happen in a month or 2. I'm telling you that it's possible. And it's only possible when we start looking at your body, your symptoms, your biology, and what is going on. And then we target that. Okay. General things aren't going to work for us, right? If everybody in the world says take ashwagandha and you take ashwagandha and you feel more excitatory, okay, that doesn't work for you, right? We need to see and go through what actually works for you. And what are your holdups, right? Maybe you have MTFR gene mutation and you aren't, you're not methylating and absorbing your B vitamins. So we have to work on that, right? Could be the other thing. Everyone tells you take methylated B vitamins. You take methylated B vitamins and you feel like this. Okay. You're like that, right? And that's overmethylation. That also can happen, right? So this is this fine balance of like, hey, what do you need? What does your body need? And just because this is true also in the neurodivergent community, just because this works for me doesn't mean it works for you necessarily, right? Again, the concept, right? If we all have MTFR gene mutations, which I'm not saying every neurodivergent woman does, but a lot of us do, our over methylation levels can be very different, right? I could take a full dose and be okay, and you may not be able to. Maybe we have to half your dose, or we have to every other day your dose, right? And to kind of build your system up. That's one great thing that we know about the neurodivergent system is that we like stability, right? And I tell my neurodivergent patients this all the time. We don't go up and this, right? We go up, saturate, 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 add a little more, saturate, 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 add a little more, saturate, 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 right? That is how our bodies do well. This is another phenomenon with progesterone too. Some of us do really terrible with progesterone, or we think we do. We give women progesterone 100 milligrams at night. Okay, guess what? Progesterone gets broken down to L-pregnenolone. L-pregnenolone affects GABA in our brains. Okay, great. Sometimes, though, that feels overwhelming to us. That big slug of GABA can be like, for some neurodivergent women, it is a miracle. For 80% of my PMDDers, when I get them on progesterone, they're like, Dr. Sarah, where the heck has this been all my life? Right. And some of us are like, oh my gosh, don't ever give me that again. I hate that. It's horrible. And then I look at them and what do I say? Okay, well, we're going to go to 400. And they're like, excuse me? Are you nuts, Dr. Sarah? I'm not taking 400. I just took 100 and I feel miserable. But there's a paradoxical effect in the neurodivergent brain, right? At 100, we only have some receptors saturated, and then it feels unstable to us. But if we go up to 4 and we saturate all the receptors, it feels stable to our brains, right? So there is a lot of nuance. There is a lot of tricks of the trade that our neurodivergent bodies need from a hormonal perspective. Okay. And even doing that. And then one of the biggest pieces, I think, if you have, let's just pretend you're on a deserted island and you have absolutely no access to a doctor or provider. One of the hugest things that you can impact your life with is decreasing your sympathetic overdrive. Okay. We are all in sympathetic overdrive by the nature of our diagnosis and by what we've had to do, especially as women, with having this diagnosis, what we've had to do to be as bad ASS as we are, the masking, right? The reading the rooms, oh my gosh, the stimming, all of those things are very exhausting. Okay. And we're so sympathetic, right? Because we are trying to keep everything up. So if you are stuck on a deserted island with no doctor, no medicine, no advice, number one, hopefully it's warm and you can get some vitamin D. But the first thing that I would do is attempt to downregulate your sympathetic system. And I will tell you this, if you can do that, that is one of the most powerful things you can do. Because even if I get the hormones optimized, if I get the vitamins optimized, right? If we get going, if you do not work on that sympathetic spiral of doom, you're not going to have the same effect as you possibly could. Okay. And I see this all the time. I use something in my office called ExoMind. It's transmagnetic cranial stimulation. And that's exactly what it does. It takes you from here to here. And very resistant patients that, I've had, and I've done all of the things. We've worked on all the things. We've worked on the gut. We worked on all of that. And they feel a lot better, but not 100%. We put them on ExoMind and down regulate that sympathetic drive and they feel good, right? They feel good. So if there's one thing you could start doing today, it would be to start right down regulating, whether that's a vagal nerve action, right? There's vagal nerve stimulators. You can take deep breaths, like 4, hold for 4, out for 6, all the way, all the way, all the way. Repeat that 4 times. In for 4, hold for 4, exhale for 6. I feel it. It just downregulated my vagus nerve. Do that 2 times per day. Do that when you start to feel like this, but do it 2 times per day anyways, because our systems are so overloaded. That's the best advice before all of this, while you're trying to find a provider, while you're joining neurodivergent groups and trying to see what works for people, while we're taking the right supplements. If we could just downregulate our sympathetic drive, even by 5%, 10%, 8%, I'd even take 2%, you're actively going to feel better. Okay. It takes all of the things, ladies, it takes all of the things, but you will, if that's one thing you could start doing, and you don't need anything, you can start doing that on your own. That is where I would start, right? That is where I would start. And that's all of the questions that I actually have that were submitted. There was a couple that fell kind of into that realm. But I want to end this with saying that this isn't simple, right? It isn't easy, but it's completely and utterly doable. Okay. And I've completely and utterly changed my life and my my coping strategies and how I handle the day to day by doing all of these things together. And yes, it takes work. And yes, it takes effort. And yes, sometimes it doesn't work, but we're here together. right? The whole point of creating this community and creating this tribe is that we go and we tell everybody what we know and we teach and we learn, right? At the same time. And we say, oh, that worked for me. Nope, that didn't work for me. Try this. It may work for you. It may not work for you. We have to share that advice and we have to demand from the medical system that they acknowledge our neurodivergence, okay? Because we've been sitting in the corner for far too long. And I'm over it, right? I'm sure you're over it. I'm over it. Like, we deserve this. I'm trying on our end. We are trying on our end from a medical piece. We are educating the masses so you can go out and you can demand what you deserve. So we need your help, okay? As amazing members, you have access to me, so you can submit a comment, and I'm happy. I'll answer that. Remember, next week on the 8th is our first webinar for our paid subscribers in sleep in the neurodivergent brain. So don't miss it because it's going to be really, really great. And then go out and tell your tribe, right? Tell people, talk about it today. If you learn something from this, or even if you have more questions, make this be part of the conversation, right? We have to be talking about it and doing it. And I will see you next month also for our live Q&A. Bring the questions, right? When things come up or something happens this month and you're like, ooh, let me ask Dr. Sarah, bring the questions. That's what this forum is meant to be. It's what part of being the tribe and what I want for us all. Okay. So I'm going to see you soon. Okay. Until next time, stay well, guys.